Hello, everyone. A very good evening to all of you. I'm Sayukta from beautiful Spotless Skin team, and today we'll talk about melasma. Melasma एक ऐसी स्किन कंडीशन है जो बहुत कॉमन है, क्रॉनिक है और महिलाओं में ज्यादा होती है और कई बार उनके चेहरे पे हम फ्रेकल्स देखते हैं, ब्राउन कलर पैचेस देखते हैं. And to talk on it, we have with us a renowned dermatologist. We have with us Dr. Anju Jha from Delhi. She is a consultant dermatologist with more than 23 years of experience in the field. She completed her MBBS from Medical College, Calcutta in 1996, and MD Dermatology, Venerology, and Leprosy from Government Medical College and Rajendra Hospital, Punjab University, Patiala in 2001. She is also a member of Indian Association of Dermatologists, Venerologists, and Leprologists, IADVL. And with her expertise today, Dr. will enlighten us more on melasma and its management. A very warm welcome to you, Dr. Anju Jha.
Thanks for the kind introduction.
So, Doctor, today we are going to talk about melasma. Melasma is quite common in our society. We see a lot of people, especially women, with melasma. First of all, what is melasma? Melasma kya hai?
See, melasma is pigmentation of the skin. So, melasma, you can say, is one of the causes of pigmentation, whereby we see dark patches on the cheeks, which we call the malar area, the nose, forehead, and sometimes the chin. So, this is pigmentation of the skin, जिसे हम आमतौर पे झाइयाँ भी कहते हैं, और वो अक्सर सबसे ज्यादा हम गालों पे देखते हैं और कई बार वो नोज पे, अपर लिप्स, बेसिकली सारे सन एक्सपोज्ड एरियाज में इस तरह की पैचेस आ जाती हैं, डार्क पैचेस.
तो इसकी वजह क्या होती है डॉक्टर? व्हाट आर द कॉजेस?
See, the causes of melasma, it is actually an interplay of certain factors. The family history, genetic predisposition, then cumulative effect of sunlight. चाहे अगर हम डेली भी अगर आधे घंटे सन एक्सपोजर होता है और एक फैमिली हिस्ट्री भी पॉजिटिव हो और आप किसी हार्मोनल चेंजेस भी हो, जैसे कि प्रेगनेंसी, पोस्ट प्रेगनेंसी, इस तरह की झाइयां होने के चांसेस और ज्यादा बढ़ जाती हैं. सो इट इज अ इंटरप्ले ऑफ 2 to 3 things, and the most important is the sun exposure. That can be a few months of sun exposure, and that can be a cumulative exposure of sun exposure of a few months also.
So, as you said, sun is the biggest culprit. So, is there a way, doctor, to prevent it? Because we always say prevention is better than cure.
So, see, the thing which is preventable is obviously the sun exposure. We can stop the sun exposure. We can take necessary precautions for the sun exposure. For this, we should use a sunscreen regularly. And if we are out on a vacation or something, we can use other methods of sunblock, like using wide-brimmed hats, using a stole when you are outside in the sun for too long.
Right. So sunscreen plus the physical barriers, they can play an important role in preventing us. Now, doctor, we see that because melasma is so common in our society, we have seen a lot of people going for home remedies or for over-the-counter topical applications or by what the influencers on various social media platforms are asking them to do. What are the harmful or the side effects of going for these in case of melasma?
See, I would say that most of the things which people they are doing on their own are very harmful. लोग अक्सर अपने पार्लर जाते हैं और वहां से उन्हें कुछ नुस्खे दिए जाते हैं. At times, people they go to the chemist and buy medicine, and most of them they are steroid preparations, and they cause lot of damage to the skin. So, जब तक वो डॉक्टर के पास पहुंचते हैं, till the time they come to the right doctor, I think much damage is already done. So, even if you have little bit problem, I think the best way to go about it is to consult your doctor and take the right medications. कई बार जब आप गलत चीजें लगाते हैं तो उससे वो चीजें और खराब हो जाती हैं और फिर ज्यादा टाइम लगता है उन्हें ठीक होने में.
बिल्कुल. तो अगर मेलास्मा है, स्पॉट्स हो रहे हैं, तो सबसे पहले क्वालिफाइड डर्मेट के पास चाहिए डॉक्टर क्या होता है एग्जैक्टली व्हाट आर दी साइंस मतलब आई एम श्योर ओवरनाइट मलास्मा नहीं होता ग्रेजुअली वो इंक्रीज होता होगा उसके बारे में अगर थोड़ा बताएं ताकि जब भी साइन हो तो हम एक डॉक्टर से संपर्क कर सकें
हाँ, सी द फर्स्ट साइन ऑफ मेलाज्मा इज, और झाइयों के लिए क्या होता है, यू स्टार्ट डेवलपिंग अ पैच ऑन द फेस, a dark colored
राइट
small patch which starts to develop maybe on one side and gradually both sides. And one keeps on waiting कि ठीक हो जाएगा, लेकिन फिर वो धीरे धीरे बढ़ जाता है. और ये कब बढ़ता है? मोस्टली फीमेल्स में पाए जाते हैं, एंड ड्यूरिंग प्रेगनेंसी और अराउंड द चाइल्ड बर्थ टाइम, आफ्टर चाइल्ड बर्थ it starts to increase. At times it can be increased by certain medications also. If the patient is taking oral contraceptive pills, तब भी ये चीजें थोड़ी सी जल्दी बढ़ सकती हैं. या फिर आपके आउटडोर एक्टिविटीज ज्यादा है, आउटडोर एक्टिविटीज, सन एक्सपोजर ज्यादा है, फिर भी ये प्रॉब्लम्स धीरे धीरे बढ़ सकती हैं. शुरुआत में मे बी यू कैन हैव अ वेरी लाइट पैच, बट ग्रेजुअली over the months or years it can grow big, and it can become more.
okay doctor when a patient comes to you with signs of melasma do you recommend test for diagnosis or just by clinical investigation you're sure
See, mostly melasma is a clinical diagnosis only we make, by the features, by the distribution of the pigmentation. It is always present on the sun exposed areas, and it has got a patchy distribution. And at times we do go for certain test, but that test is done to see the type of melasma one is having, whether it is epidermal, सिर्फ ऊपर वाले layers में melasma है या अंदर तक भी जा चुका है, जिसे हम dermal melasma कहते हैं. तो उसके लिए हम कई बार वुड्स लैम्प या डर्मोस्कोप की भी हेल्प लेते हैं, और उससे फिर हमें पता चल जाता है कि किस तरह की melasma है. But as such,
and doctor
not no histopathology is needed, or it is more of a clinical diagnosis only.
right and how do you treat melasma what are the treatment options available
See, for treatment, what we do is, the first and foremost, the most important thing is sun protection. So I tell my patients, if you're not using a sunscreen, there is no point in treating your melasma. So sunscreen is a must. After that, then there are lightening agents which we use. Most commonly, we use, first line treatment, we use hydroquinone. And apart from hydroquinone, we have something like kojic acid, azelaic acid, and different preparations which we give for application on the face. And apart from that, oral medications, they help, because something like tranexamic acid we give. But all these medicines are to be taken with the advice of doctor, and they should not self medicate.
right doctor a very common question that people with the melasma often ask is that can melasma be permanently cured
See, what we say is melasma cannot be permanently cured, is actually a true statement. But more than that, I would like to say is, melasma is something for which you need prevention always. So once you take treatment for your melasma, and if say even if you get 80 to 90% result, you have obtained that result, it is very important to maintain that result. For that, you have to take sun protection always, because your skin always remains sensitive to sunlight and it can come back again.
right and doctor as you said sunscreen plays that you have explained but regarding sunscreens what are the basics that we should go for when we are going to purchase a sunscreen and how to apply how much to apply when to reapply
See, again, that is very important. For melasma, when we go for a sunscreen, when we need a sunscreen, we have to see that we need a protection from the whole range of ultraviolet rays. So it should have ultraviolet B prevention, ultraviolet A prevention, infrared prevention, and visible rays prevention also. So a sunscreen which meets all these is the most effective sunscreen. So for this, if I say, the simplest would be to go for a physical sunblock, which gives both UVA and UVP protection. And one can also go for a combination of UVA and of organic and an inorganic, that is a physical and chemical sunscreen mixed, also can be used for the protection. And when it should be applied, it should be always, the sunscreen should be applied 20 minutes before sun exposure, and it should be repeated after every 3 hours. And if you have melasma, I advise my patients, even if they are indoors, they should apply sunscreen, because it is very important that you prevent yourself from all types of ultraviolet rays.
Absolutely. Even at homes, inside the offices, we have LED lights, laptops, mobiles, etc., and they are equally harmful. Now, doctor, how much to apply?
So how much to apply? See, actually, you have, they say that you have to apply on face almost 1 teaspoonful of small teaspoonful of sunscreen, and
Hmm.
it should be applied on the entire face properly. So I think it should be applied very nicely. The SPF should be at least 30 SPF. So maybe in Indian population or scenario, it might be difficult to apply so much of sunscreen. But uh, all said and done, it is very important that you should take enough of those sunscreen, and should be applied properly on all the sun exposed areas.
And doctor, before we sum up the whole session, any take-home message or closing remarks for our viewers?
So see, for melasma patients, what I would tell them is a sunscreen is a must. Even if you are frustrated after months of treatment also. So one thing which you cannot leave is your sunscreen. And I do tell them that if you use a very good sunscreen according to your skin type, according to the skin type which suits you, maybe gradually over a period of months and years, your melasma will come down. But never leave your sunscreen, and always choose the right sunscreen. So it is very important that you don't go with any sunscreen which you find outside. You should go for a sunscreen which has a UVA and UVB both protection, and it should be almost applied around the clock, especially during daytime. You cannot go without sunscreen even if you are indoors. And rest is the topical applications, also the medicines, the topical medications and oral medications. Don't self-medicate. There are harmful effects of the treatment also. So certain topical medicines, if you keep on applying them a lot, then it can also harm you. So always, for that topical medication application, also consult your doctor, and just stick to the treatment properly and use your sunscreen. I think that is the most important thing for melasma.
So sunscreen seems to be the most important thing, and in case you, and of course, maintenance is equally important. Thank you so very much, Dr. Anju Jha, for your valuable time. It has been a very informative session for our viewers, and it was great to hear you. Thank you so very much.
Okay, thanks.
And viewers, thank you for your active participation, and stay connected to our beautiful Spotless Skin page. Have a great evening ahead. Goodbye.